Now that we've gone over how to read a genetic testing report, we will now move on to how we use this information to explain the variable presentation of SCN2A related disorders. As we discussed before, we can divide variants into categories according to their level of function within a cell. And those categories are gain of function, loss of function, or a mixture of both. As I mentioned in the previous video, this is not related to your child's functioning, but rather how the sodium channel is functioning within the cell. The way that these categories are determined involves a lot of complex testing methods that I won't be getting into today. What is important to ask your doctor or your genetics provider is, what is my child's variant? Is it a loss of function, gain of function, or a mixture of both? I am going to touch on how the different categories may present with different symptoms. The first category we will discuss are gain of function variants. Gain of function variants in SCN2A make the sodium channels they encode for overactive. In other words, they are open too often and let too much sodium through. This increased activity can explain the typical presentation we see, which includes early onset of seizures within the first few months of life, as well as a later onset of ataxia or poor muscle control. Kids with de novo or new gain-of-function variants can experience infantile epileptic encephalopathy or benign familial infantile seizures. Kids with inherited gain-of-function mutations are likely to have benign familial infantile seizures. Gain-of-function variants are almost always missense variants. The second category we will discuss are loss-of-function variants. Loss-of-function variants in SCN2A mean that the sodium channel are reduced or eliminated or are not functioning well. In other words, they may be absent or open too little, thus not letting enough sodium through. This decreased activity can explain the typical presentation we see, which includes autism and intellectual disability. 20 to 30% of people with a loss-of-function variant may present with later onset epilepsy, which presents between 1 year and 30 years of age. This epilepsy can present pretty severely and can be hard to manage with medication. The third category we will discuss are variants that are a mixture of loss and gain-of-function mutation. This category is a newly emerging category. Some of the symptoms we can see are infantile spasms beginning before age 1, as well as some movement disorders like chorea. For all of these categories, it is really important to ask your doctor how a variant will impact symptoms. These were a very broad description meant for general education, and everyone's change is different and should be interpreted by a genetics professional.